This is for speech and language therapy for people who have head and neck cancer. So if you put yourself in their shoes, somebody who's had head and neck cancer will most often have surgery, and then they will have a problem with speech and swallowing. So they need to regain the muscles and be able to speak and swallow better again. So usually what happens is you have surgery and then you have a round of radiotherapy for 4 to 6 weeks, in which on each day you have to go and have speech and language therapy with a nurse, which is exhausting if you can imagine after surgery going to radiotherapy. In Wales, on top of that, these patients had to travel sometimes 6 hours each day to go to the speech and language therapists in Swansea. So that just added to a lot of the stress and meant that a lot of patients just didn't turn up, which creates problems along the line.
Just quickly, a bit of background. Back in 2007, we had a generalist head and neck nurse come to Macmillan, and she was appreciated and acknowledged that we were having an increase, or she was seeing an increase in head and neck cancer patients coming through the door. She also acknowledged that there was a lack of speciality in head and neck clinical nurse specialists, dietitians and speech and language therapists. She also recognised that in South West Wales, Swansea being there where the Swansea Cancer Centre was, lots of the people were having to travel in and back, and it was an increasing problem. So she came to Macmillan and we agreed to fund the first Macmillan head and neck clinical nurse specialist in Swansea in the cancer centre. But also her long-term view was that how are we going to help these patients to save them from the travelling, because there was increase in patients missing appointments, refusing surgery, refusing chemotherapy, and all because the travel issues and the rurality of South West Wales. So her ultimate aim was to try and set up a telemedicine service via video conferencing. And as I said to the previous group, at that time, talking almost 10 years ago, that was seen as a bit of a wacky idea, particularly from within the health board. But actually, when patients were spoken to, and Macmillan were very much about, as we still are, innovative and new ideas, the patients were very much on board and were prepared to try. I wouldn't say anything, but to save a 6-hour round trip, they were prepared to try this. And eventually, through the success of having specific expertise in head and neck cancers, Macmillan helped fund the telemedicine project in South West Wales. So the headquarters is still in Swansea, here where the team are, and we have video conferencing equipment at each of the sort of local general hospitals, and it saves the patient having to travel in and travel out, because we were seeing it, or the team were seeing an increasing number of patients who were just not turning up. Basically, they weren't even, with all respect, they weren't even contacting us to say we won't be coming in. Yeah. They just didn't turn up. People refusing surgery again, and people refusing treatment simply because of the rurality of the Southwest, the problems with the roads and the transport,
the expense. And I think it might be a good point here to show. We just have a
short video of the team.
So you can see, the nurses in Swansea. The patient is here, and there's a support worker in each hospital helping them out. So a support worker, which is cheaper than a nurse. And the beauty of this is that everybody's happy. There's 100% satisfaction from the patients and 100% satisfaction from the nurses. 95% of the patients say they prefer video conferencing rather than having to travel. But you also have a very good example about the cost, how much it costs somebody to do this.
Yeah, if I just give you a specific case study for someone who's having radiotherapy for 30 days, from sort of Aberystwyth down to Swansea, you're talking around a 200-mile round trip every day. Okay, so that can be up to 5,000 miles driven over the period of time. That's 135 hours spent in the car. There's over £800 in petrol costs. And this particular case study of this chap who lived up in Bronglais, his wife suffered with Alzheimer's, so he also had to pay for a carer to come in. So we had all these hidden costs. That was over £5,000, sorry, just to cover that. Plus all the other costs of weight loss, etc., feeling the cold, paying for heating bills. We were running into the thousands.
7,000 in a month. So you can imagine how somebody would just give up, not bother doing that.
So it's proved a massive success, really. So much so that our dermatology team, which I forgot to mention, our dermatology team down there are hoping to sort of adopt this process as well.